Hi, my name is Megan McMaster, and this is my overview of Module 4. After initially assessing the patient that came through the emergency room with EMS, my preliminary impressions were that she was withdrawing from most likely alcohol due to her wanting a bottle, but it could be involved with other substances as well. I also believe that she is suffering from a mental illness. She was very confused, so I'd assume that it would be some sort of mood or psychotic disorder like bipolar or schizophrenia. Due to her visible lack of hygiene and odor, I would suspect that she would probably be homeless as well. I believe her hands were shaking due to multiple variables. These variables include dehydration, withdrawal, fatigue, and or hunger. I believe this patient is confused and combative because she is possibly unsure of where she is and if the medical staff is there to help or hurt her. Many people who have struggled with mental illness can have severe paranoia, and if she is also high, drunk, or withdrawing, it can enhance her behavior. I would do a full workup with this patient to get the best possible outcome for treatment. Mental health status and history, physical assessment, lab tests including a complete blood count, blood sugar, alcohol drug screen, urine test, and a liver renal function test. This patient is clearly battling a few demons, and if she has been diagnosed and left untreated, her abuse and illness can cause a magnitude of short-term and long-term effects. Her mental state can worsen, including her paranoia and anxiety and possibly depression. She can become more delirious and possibly manic as well. That could either lead to self-harm or even suicide. If her toxicology report comes back positive for either alcohol or drug abuse, she could battle different issues such as cardiovascular or lung complications, a lack of appetite, or complications with her normal brain functions such as memory loss, inability to retain information, or managing anxiety and stress. According to the National Institute of Drug Abuse, drug use can also have indirect effects on both the people who are taking drugs and those around them. This can include affection of a person's nutrition, sleep, decision-making, and impulsivity, and risk for trauma, violence, injury, and communicable diseases. For my research question, in order to help those that are suffering with mental illness, many factors are needed to be taken into consideration. Each mental disorder is treated differently, same as each patient. Even if two patients are suffering from the same disease, they are suffering them in their own specific way and need individualized attention. Individualized treatment will give each patient their best chance to treat their specific disease. Many of those that do suffer from mental illness fall into drugs or alcohol abuse to help cope or in their minds manage their disorder, therefore adding even more obstacles to overcome during treatment. The lack of resources and knowledge can play another factor in those seeking help. Medications are available though and are treatable and accessible. Treatments that help mental illness outside of medications include psychotherapy, talk therapy, hospitalization, peer or support group therapy, complementary alternative medicine such as naturopath medicine, or a self-help plan. A self-help plan helps the individual really address their own condition and implement several strategies to promote their own wellness to help prevent their triggers and their path to recovery. Since 2014, most individual and small group insurance plans are required to include mental health and substance abuse disorder services. Medicaid programs also provide some sort of medical health services as well. Websites such as healthcare.gov do provide an array of options to obtain health insurance coverage by a few agencies. Healthcare insurance has not always been a big ally in supporting those who do suffer from mental illness, but they have made more efforts to do so. Unfortunately, there are some ways around providing coverage based on in-network or out-of-network providers. and the specific insurance company that will work with them. When health insurance companies have an inadequate network of professionals to provide mental health care in a given area, they effectively discriminate against people needing that care. Bogus 2020. Although there are steps in the right direction for providing care and have made great strides in doing so, I do believe that there are many ways to improve, and there's still work that definitely needs to be done for those that do suffer and might not have health insurance or the right resources. Luckily, insurance providers do help cover prescription medications, substance abuse treatments such as inpatient therapy, residential treatment, intensive outpatient treatment, and even some provide hospital treatments. Some treatments that may be covered by insurance can be behavioral therapy, talk therapy, cognitive behavioral therapy, and even electroconvulsive therapy in the most severe cases. These benefits are semi-deemed essential and have changed healthcare coverage greatly for those in need of help to treat their mental illness. Even though that there are limits to which medical providers you may be able to use, insurance is not allowed to deny coverage for your pre-existing condition of mental health. Many people believe that healthcare should be free for all, but they are doing steps that have been taken in the right direction to provide a better care for those battling these diseases. There's definitely always room for improvement, but luckily strides are being made.